registered consent. In Mississauga, 18% have registered consent. Today in the Peel region, 206 people are on that medically urgent wait list for a transplant. 206 of your neighbors. 10 in Caledon, 94 in Brampton, and 102 in Mississauga. Let me give you some comparators of registration rates. As I mentioned, 21% of the people in Peel have registered consent. Those are people 16 years of age or older with an OHIP number. In Toronto, the number is 19%. So you are ahead of Toronto. In York Region, it is 24% compared to Peel's 21%. In Sudbury, Northern Ontario, 49%. Communities differ. We are here this morning to ask something of you. We are here to ask that Peel Regional Council approve running a registration drive that challenges all of your residents who have not yet done so to register consent. Your first responders have agreed to do so. We have seen in the past that competitive challenges can be tremendously successful, fun, in fact, and very motivating. That is what we ask of you, and what we offer you is to make it absolutely easy. We commit to making it easy. We will provide you with all the support, all the materials, with volunteers, with guest speakers. We will make it easy for you to run this registration drive. That is what we ask of you. All we want is your endorsement and the name of the person or persons with whom we should work, and there will be action. The bottom line is, we don't just want you to walk with us. We want you to walk ahead of us. We want you to walk in front of us, because when you talk, people listen. Please consider our request. Thank you so much for welcoming us this morning.
Thank you. Mayor Thompson.
Thank you very much for your delegation. You know something, we're too low. We need to be way above the provincial average. That's who we are in Peel. We're a generous bunch. I have to say, not just myself as an organ donator, it's my family. And I think it's very important. And a good friend of mine who sits on Caledon Council, he lost his wife a few years back, and it was sudden. You know, she was been a long-time volunteer, had a lot to do with women's hockey and everything else. And when he got up and did her eulogy, as he said, all accomplishments and what a wonderful person she was, and she was. But he said she's gone on to help 25 others. And I'm going to tell you, if anybody, after you heard him explain why they did it as a family and as a role, that you at least left this world to make it a better place by helping people, anybody that was not sitting in that room that didn't sign the donor card, shame on them. It was the most powerful moment you could ever imagine. But I think this is something that we all can give back. And, you know, I can probably say we're 29%, but I like to think that we can double that. But my challenge to you is not just asking people, asking them to do it as a family unit. That's what I would encourage you to do. Thank you very much.
Thank you.
Thank you. Mayor Crombie.
Thank you, Mr. Chairman. I too want to thank you for coming forward today. I have friends who have donated organs. I have friends who have benefited from having organs donated. So I too am in the same camp as Mayor Thompson. I want to thank you for your very moving remarks. I too feel that the numbers are too low in Mississauga. Not even a fifth of our population is signed up to be an organ donor. And I wondered if there were cultural reasons that prohibit some people, some groups from donating organs. If you might speak to that, if there's those barriers that exist in some groups, and in some way, if we can help overcome that. I know on my part, I'm happy to go out and speak to them. I'm sure my counselors are as well. Can you let us know, please?
We certainly see that the more diverse the community, the lower the registration rate. And typically larger communities that tend to be more diverse have lower registration rates. We are reaching out to these communities. We measure the rates within various communities and make very direct contact, but we would tremendously appreciate your assistance in reaching out to them because, as I said a moment ago, your influence is much greater than ours. But thank you very much.
On behalf of myself and my council members, I know I speak for them all, that we'll all do whatever we can to help you, assist you to increase those numbers for next year. Thank you.
Thank you. Councillor Raz.
Thank you very much, Mr. Chair, and thank you very much for your delegation today. I think it's so important that we need to get the word out to be a donor. I do have friends. One of them is a double lung transplant recipient, and he is doing amazing today from lying just, I think it was maybe about 3 years ago, barely alive in a hospital bed. And a few weeks ago, he was walking up the stairs at the hospital, and he bumped into a surgeon who he has never met before. And the surgeon just thought it was amazing that he was using his new gift to take the stairs and make himself even healthier. So it's just a lovely story. But they're huge proponents of the donor program. And I know I'm having a big community event in April that I will work with you and contact the Be a Donor organization to hopefully we can get some signups there. So my newsletter and everybody I think is on board that we need to do more, and we will do whatever we can to use our influence. Thank you very much.
Councillor Fonseca.
Thank you, Mr. Chair. Thank you so much for being here. I'm registered, and I had the opportunity. My father passed away suddenly in 2013, and he was the one that inspired myself, and I have 3 siblings, to make sure that we were registered. He made it very clear that if anything was to happen to him, that it was not even something that something that we should contemplate, but that his organs, he'd already signed the donor card. At that time, there wasn't the Be a Donor. When he had signed on, there wasn't the program that's in place right now. But I had the amazing opportunity to attend the celebration that you have, because my father did donate, our whole family did. And it was just incredible to see the life that has been brought into multiple donor recipients. So I just want to thank you for all that you do. I try to tweet and use social media wherever I can to promote organ donation, and I'm happy to promote it in any way possible. As Councillor Ross has also said, I'll work offline with you to any events that I'm having in the future to do that. But I think just to thank you, it was incredible, and having that experience and being there, because there is a hesitation among family members when something like that happens. You're at the point where you're just trying to deal with what has happened, and there's a hesitation to let go. But then to be able to see what that gift of life is and how it can change others' lives so significantly is just incredible. So thank you very much.
Thank you. Mayor Thompson.
One thing I meant to mention is we have Caledon Day. What day is it, Councillor Ennis? In June. And it's on a Saturday, and I will welcome you to our booth at the town of Caledon, and you can have a kiosk there, and hopefully you can sign up donors as the people come, because we get about 8,000 people out, so this is big. So
Thank you. Councillor McFadden.
Well, thank you, Mr. Chair. I think it's also important that you encourage the young people, including babies, the families of young children, to donate, because I was certainly in that position with my grandson where he was in need. And it's very highly unlikely that you get a donor that's an infant under the age of 3 months old. So if you could encourage that in the literature, that would be extremely important too. Luckily, he made it through, but yeah, thank you.
Thank you. Councillor Moore.
Well, thank you. In Brampton, we're celebrating Celebrampton in June, and I'm happy to take this back to staff and ask that they, if you've got a booth or how we can incorporate it into the activities and the festivities of that day. We have a tremendous turnout. It's always a little bit dependent on weather, but I do think that there is opportunities within the city of Brampton, even setting up something in the atrium, for our own staff to raise awareness. I think I may have told by the way, the last time you were here, I went home online, and I'd always carried the donor card in my wallet, but I did go home and register online, and so did my husband. I think I may have told the story at the time. My mom passed away in a hospital in Buffalo. And in Buffalo, the procurement folks, or in the U.S., I think generally, when there is a passing in the hospital, the procurement folks are right there. They're the first folks that are visiting the family. And I know my dad, because it was very sudden, she was 58 years old, was very reluctant to sort of make that decision. So I hear what you're saying in terms of the emotional setting that you're in, and really you're kind of emotionally fragile when they do approach you. But my dad and I had a conversation, and in the end he made the decision to donate. And when he received a couple of letters, because they go through the procurement folks, he received a couple of letters from folks that benefited the recipients of her donation. It made him feel like he had made the right decision. They came anonymously, of course, but it was a nice gesture that they offer. I don't know whether we do the same thing, but it really, we do need to raise awareness. We have high needs, just the numbers that you talk about in Brampton, Caledon, Mississauga, for the number of folks on the transplant list. My neighbor died right before Christmas, 52 years old. She was on the list for a liver transplant, and they weren't able to find one in time before her health declined to the point. So, it hits close to home, and for all of us at some point in our life. So, thank you.
Thank you very much. And to both you ladies, I want to thank you for your presentation today, as well as for being such strong advocates for the Trillium Gift of Life Network. And I know all of council will help spread the message to their constituents when they're able to. I just wondered if Mayor Crombie and Mayor Thompson, if you'd move in second, not only receipt of the delegation, but also to endorse the challenge for a Peel Region registration drive?
Absolutely.
Okay, thank you. All in favor? Opposed, if any? Carried. Thank you, ladies.
Thank you very, very much.
Our next delegation is Joff Marinoff, Transit Director, My Way, City of Mississauga, and Adoma Patterson, Advisor, Peel Poverty Reduction Strategy, Region of Peel, regarding affordable transportation pilot program.
If I may, I'm just going to make some introductory comments to introduce them. So this is Council Report 10.2 and 10.3. And through you, the Chair, I'd like to introduce these delegates and give you context, because we are joined by a colleague here, Joff Marinoff, the Transit Director from the City of Mississauga. And I appreciate him coming to demonstrate our collaboration on the first pilot that we're reporting on, the active transportation pilot. The affordable transportation pilot, and he is joined by Adoma Patterson, who is the regional lead on the poverty reduction strategy. The second pilot that we're bringing to you in the report 10.3 is one that came about as a result of the positive impact that the first pilot had, where we saw individuals who were subsidized to use public transit for employment, involvement in the community, those who had mental health challenges, for them to receive assistance. We saw them increase their ridership beyond the subsidy. So we are bringing back for your consideration, in partnership with the City of Mississauga, a second pilot that would use primarily provincial funds through our social assistance funding to look at this pilot for a different group, a low-income group, who also are in need of this support, and to do that over the period of 2016. So I'll let Joff and Adoma give you the details of the pilots.
Good morning, Regional Council. Thank you, Gail. Thank you for the opportunity to present and share with you the work related to the Affordable Transportation Pilot Program. I wanted just to provide a bit of background information about how the pilot came about. You may recall that in 2008, the provincial government released its first poverty reduction strategy, Breaking the Cycle. And as a result of that and some research that the Region of Peel had undertaken in 2005, community partners came together here in Peel, including representatives from local government, the nonprofit sector, and residents, and formed the Peel Poverty Reduction Strategy Committee. In 2012, we launched our first ever local strategy, and affordable transportation and accessible transportation was one of our 5 pillars. Many people told us that transportation was a barrier for them getting to work and to other things and participation in the community. It is worthwhile to point out that since we noted that and made it one of the pillars of the strategy, that other municipalities such as the City of Hamilton, York Region, Halton Region have already implemented affordable transportation programs. They started with pilots and have moved into permanent programs geared to low-income residents, Ontario Works recipients, and or ODSP clients. Toronto now is also considering that. They've just released their 20-year poverty reduction strategy. So here in Peel, My Way opted through our conversations to work with us on a first pilot. I will now hand it over to Joff to tell you some of the details about the Phase 1 results.
Chair Dale, members of council, good morning. This journey started a number of years ago at the request of Mississauga Council to look at affordable transportation options for the residents of Mississauga. We did a body of research, looked at other jurisdictions, and subsequently sought funding for a pilot which was approved in the 2015 budget, reached out to the staff at Peel Region, and partnered with them to deliver what we are calling now a Phase 1 pilot, which ran from September to August 2015. When My Way picks up a customer at a bus stop, they're largely anonymous. They may know their bus driver, but we really know nothing about them unless they make subsequent contact with us. And that's one of the reasons why the partnership with the Region of Peel is so critical to this program, in that they have the relationship with those people in need. They understand the needs from a social equity perspective, and we're really focused on service delivery, and we really need that expertise to help us design and evaluate and adjust these programs so that they're as effective as possible. This program was based on Ontario Works because that was a group that was easy to pilot with. They had an opportunity to buy the equivalent of a monthly pass for 1/3 the cost. We actually piloted the Presto card because we are moving to a fare card in the GTHA, and so that was another thing that we were able to try. And what the pilot really saw is that it really increased the access and mobility of those individuals that participate in the program, in that they had access to employment and other aspects of community engagement. The results of those that were surveyed, and again, this survey was conducted by Peel Region staff, showed that people markedly increased their usage of transit. We can see that they use transit to get to places that you'd expect, employment, medical, education, to places of religious assembly. But one of the other things it did give them access to was to grocery stores for healthier choices for food, or perhaps to food banks if that was needed. And we also found that Ontario Works clients would have high school students who needed to get to high school, and we opened the program and allowed them to use that, and this allowed better attendance at high school because the students were allowed to access this program. And some of the quotes that came back from the residents, here's one there. It shows that they really valued the program. But what we did see is that they were allowed to move around much more. They were able to access their support network, which was friends and family. And when we look at the value for every dollar we invested into transit, we basically got about a $6 return in terms of social outcomes. And so the money did achieve a lot of things in terms of access to employment and medical care and things like that. And these are the things that we wouldn't have been able to assess at My Way, and without the region, we just could not have achieved this. We're now hoping to move on to a Phase 2 pilot. The original pilot was focused on Ontario Works clients, but that is only one segment of people in need from a financial perspective, and we want to open the program up to all residents in financial need. So that would be youth, right up to seniors and everything in between, and especially the working poor who may have precarious employment, who just don't have the financial resources to access better employment or participate fully in the community. We sought funding in our 2016 budget, which was approved by our council, and we have $1 million, just over $1 million in our budget that's been approved for this program, and we need the region to support us from the program design and an evaluation process, because they have access to those clients who are most in need. I'd now like to hand over this to Adoma to talk about that regional support.
Thanks, Geoff. So as Geoff explained, the region wouldn't contribute directly to the cost of the monthly passes, but provide the support, the back end, and all of the expertise related to design and evaluation of the second phase pilot. So we anticipate that there are 4 sort of phases that we would go through in the next several months to get to where we need to go in understanding the needs of low-income residents related to transit. So the design stage lays the foundation for the pilot. It includes creating a plan for how the pilot will be structured and evaluated, as well as developing a communication plan and making sure we've done our due diligence. So some of that, as Geoff mentioned, we did in the first phase by consulting with other municipalities who had already tried this, talking to them about the lessons learned, what are some of the things that they saw that worked and didn't work. The implementation stage is divided here on the screen between startup and ongoing, and focuses on the execution of the pilot. So we talk about marketing, recruitment, eligibility screening of up to 2,500 participants, as well as holding orientation sessions, and really being there to sort of troubleshoot. It was one of the lessons we learned from Phase 1, that some folks do need additional support, and so we would be providing that. The implementation ongoing stage centers on the activities related to the functioning of the pilot. So the surveying of participants, replacing of Presto cards, so the administration of managing a pilot where there are 2,500 people involved, the database, and any additional support that specific segments of our population may need, such as seniors or clients who may have other challenges that prevent them from getting on the bus. And then, of course, the evaluation stage is compiling the data that has been collected and facilitating focus groups with the participants so that we can do a bit of a deeper dive and understand really what the needs are. And that will result, of course, in a final report. So the total estimated cost for the entire design, implementation, and evaluation of the pilot, we anticipate to be $400,000. And so just in looking at some of the anticipated benefits, so similar to Phase 1 of the pilot, we anticipate that Phase 2 will have a positive effect on the social determinants of health, such as employment, education, food security, and access to services. So that what this means is that folks will be more likely to accept, a temporary job through the temp agency, attend medical appointments, school. So the number of young people who do not have access to the schools or the school board's busing program and have to rely on transportation, they will be able to do so more regularly, go to the library, and access other needed community services. In addition, through this partnership, we anticipate My Way will have more people accessing public transportation. The region will be fulfilling its mission as set out in our strategic plan of working with you to create a healthy, safe, and connected community. And most importantly, the residents, families who participate in the pilot will experience the benefits of affordable transportation as discussed. And just as an aside, in terms of the Peel Poverty Reduction Strategy, and the committee, of course, this continues to be an important pillar for the folks that we represent and we speak to all the time. So there is a continuing concern about how transportation is connected to the other five, like education and employment. So in terms of next steps, we are seeking council approval for a Phase 2 from Mississauga and Regional Council. And if this approval is given, we are aiming to run the pilot. We start immediately and have started to lay some of the groundwork in terms of just understanding what this means from April to September in order to have results to inform a potential 27 budget process. So thank you so much for your time, and Jeff and I are happy to respond to any questions or any comments you may have.
Thank you very much. I do have a list. Councillor Miles.
Thank you very much, Mr. Chairman. I just want to start off by saying kudos to the City of Mississauga. I think that the fact that you have undertaken this pilot, which has demonstrated its success at a cost of $1 million to your taxpayers, certainly deserves some recognition by us. I just wish it was the City of Brampton that was here sharing this good news. And I see our mayor is on the board, so I'm going to guess that she's going to make a commitment, so I'm not going to say anything more. However, I would, Mr. Chairman, like to move the report 10.2.1, move receipt of that report, and move the recommendations in 10.3-1 for the region of Peel to work in partnership with the area municipalities. I don't see how this program can work without the support of the regional staff, and the fact is we are the level of government that is responsible for looking out for those in our community who are most vulnerable, and also through funding through Ontario Works. I guess the only thing that I'd like to ask and maybe have our staff take a look at is whether or not there is or could be the opportunity for Ontario Works to actually be the funder of an affordable transportation plan. And I think if we as a municipality can actually document the social benefits and demonstrate, as we have in other programs, demonstrate the fact that by investing in this kind of an initiative, we're actually reducing costs in other areas by improved health, employment, et cetera, that we wouldn't be able to come up with a pretty good argument for a provincial investment in this kind of initiatives. However, I think that it's a good program, and as I said, I congratulate the City of Mississauga and your council for taking this initiative.
David, did you have a comment with respect to that?
Yeah, Mr. Chairman, I suggest that we take that as direction, and when we report back on the outcome of this pilot, we can talk about various approaches to funding it, including that one.
Okay, thank you.
Mayor Crombie.
Thank Thank you, thank you, Councillor Miles. A little bit premature. Yes, we have the money set aside in the budget, but we haven't passed it yet, so that's why we're here today. That's why we're here today. It's contingent on the support of the region and the region's participation, and we hope it will get the blessing from everyone today. So just a little bit premature, but I'm hoping, I'm very hopeful. It is our priority, like it is many municipalities, especially other progressive governments, to assist the more vulnerable, to assist people who are low income, and to help lift people who are in poverty, and this is just one of those attempts. The reality is in Mississauga that 17% of our population is in poverty, so this is lifting those children and those families. Let me clarify that we do have a pilot project ongoing right now that gives $1 fares for seniors, and this is completely separate. That will not be touched. That money is also set aside, and this is something separate, so that will not in any way inhibit that, but it does expand the scope, because that one project, it deals with seniors accessing the bus for $1 a fare, but this expands the scope to people who are low income. So people who are most vulnerable, people like single moms, those who are precariously unemployed, food bank users, students, newcomers. So you can just well imagine it'll help them get to work, help them get to their job interviews, to food banks, to access social and community services, medical appointments, etc. The program we've seen, for every dollar invested, there's a $6 return. Now, it is a pilot project. It's very limited because we know the scope is, the universe is very large. Unfortunately, there are over 91,000 people who are low income in Mississauga, and we only have the ability with this pilot project to serve about 2,500 of them. So either you can designate an amount of money or a number of people you want to reach. Different communities, different municipalities do it differently. Obviously, we have to put a cap on what we can afford, and we've decided that $900,000 is the right amount. That was the amount we set aside in our budget. So that would help service about 2,500 people. It would be on a first-come, first-served basis. And as you see, the Region of Peel would process those people to ensure that they qualify. There would be pre-qualification. So I'm very hopeful that this does get passed. It does meet our objectives of helping to lift people out of poverty, and we welcome, obviously, Brampton to participate, but if it isn't in your budget this year, then you would benefit by seeing the results after the pilot and perhaps participating in subsequent years and years to come if it's successful, and if we choose to continue it. Of course, this would be a very limited test. I just have a couple of questions. The first one is, the first test program was with ODSP and OW residents, and there was a component that was a provincial participation. So why wouldn't the province be stepping up and funding the second phase of this pilot?
Through you, Chair Dale. So the first pilot was Ontario Works clients only, and we used funds. The funds came through the Ontario Works budget, through our existing budget, because they were already clients on Ontario Works. And so we were able to just access those provincial dollars. I think the issue of the provincial or even federal government getting involved in supporting affordable transportation is ongoing, and many municipalities and communities have been talking about it, even at the community level. So the Peel Poverty Reduction Strategy Committee, one of the tasks that came out, the recommendations that came out of phase one of the report, is to push and to advocate to the provincial government. We have said it through social assistance consultations, and so that's an ongoing thing that the community's role is, that the community sees as a role as well. So those funds, Mayor Crombie, were already existing funds. Because they were Ontario Works clients, we were able to access those dollars from the Ontario Works budget, operating budget.
I guess my second question then is that because it is the responsibility of the Region of Peel to provide social programming, why wouldn't you match us dollar for dollar in this program?
Mm-hmm. Through you, Chair Dale, may I turn that over to the Commissioner?
Sure you can, Adoma, thank you. So if it's Council's wish, you can create a motion or direct us. You came and said you had great interest in a second pilot and wanted to provide transit. Could we perform the eligibility work and do some evaluation to see how much more ridership we saw? Because we were surprised the first time how much more the individuals that participated rode. It's a different group. They're not OW clients. We can use provincial funding for this pilot. We did speak with the province to make sure that this was part of the bucket of administrative funding that they give us. So we're curious to see what happens with this group because they're slightly different. They may not, they may use even more transit. We don't know. But these are people who have fairly high-risk conditions. So there's a reason they're struggling in terms of their employment. So they did need a fair bit of hand-holding and support to access transit and to continue to use it. So we're interested in supporting this as really a test pilot. And we would very much like to explain to the province what happens and to challenge them to continue to do these demonstrative projects because of the number of municipalities who have shown an interest in this. So
Right, but
in
Gail,
terms of,
you're
we are going to
expanding.
put the provincial money that we have allows us to do the evaluation, the eligibility. It doesn't allow us to, at this point, purchase transit fare, but we're happy to advocate for that. Another alternative, if you want to direct us to use regional funds for transit, it's your choice today.
I'm going to wait and listen to the discussion, but I may come back to you if I think there's a move to support this pilot, then maybe I'll come back to the increase it. Would there be reserves available to do so?
We did in this, I think there's two mics on.
Two mics.
I think that you'll see in this second report that we did say reserves if necessary because we weren't certain how many clients we would see or how much support we need, but we anticipate, given the results of the first group, that it does take these folks a while to access a program. They don't come automatically. They don't stay on easily. So we're quite confident that we'll be able to handle it within the provincial funds. Reserves were just there if necessary. If we saw clients who were in need of different kinds of supports. So in terms of reserve funds for transit, you can ask us to report back and give you a confirmation of that.
Gail, can you tell me how would we reach those people who would qualify for this program? How would we make them aware that it is available and they are eligible for it? I mean, the communicating this program is always difficult. So how would we reach out to, you've talked specifically about the ODSP clients and the OW clients, but now this pilot expands that base. This is to people of lower income, those who are precarious employed, newcomer students, et cetera,
Right.
seniors as well. So how would we reach out to those people? How would we make them aware that this program is a pilot project and they are eligible for it?
So I'll make a general comment, and then I'll let Adoma speak to it as well. So we know a lot of these clients through the many other programs that we're providing them, whether it's social housing or ODSP, as you mentioned, or through the support for childcare if they have children in subsidized childcare, or we're seeing them through other challenges that they have in their lives, mental health and addictions, et cetera. So we know them, and it's very much a one-on-one support kind of approach. It's not, so we will do all the traditional means, put it on the website and explain to the community organizations who are working with these same folks, but it really is a one-on-one sales pitch, and I'll let Doma continue to speak to it.
Let me just say that it seems like a drop in the bucket because only 2,500 people of the 91,000 would be eligible, but it's a start, and we're doing something, and we're trying something. Sorry, Adoma.
That's okay. So Mayor Crombie, just to add to Gail's point about how we reach folks. So of course the timeline is tight for the pilot. One of the things we learned from Hamilton's experience and York Region's experience is, when there is a limited amount of funds, of course, we do have to target the outreach. And so definitely connecting with the organizations that we fund, both at the regional and then the municipal, the city level will be important. Outreach to the clients, the folks who come through our doors, whether they are eligible for our programs or not. And then definitely looking at what are some of the strategies. I think part of the pilot is to test what are some of the successful strategies to reach people who never access our programs. So particularly the working poor, folks who are working 2 or 3 jobs, who this program would be ideal for. So we have learned and spoken to our colleagues in other municipalities, and we'll use some of those lessons to apply to this pilot.
Thank you. I have one final question, and there are a lot of people on the board, so I may come back later. We'll see how it goes. Joff, I just want you to confirm for me that this money is in our budget, it has been budget set aside, and that it will not in any way deter from or cannibalize the current pilot that is for the seniors fairs.
That is, sorry, that is correct. The budget was approved for this pilot, and it has no impact on the $1 pilot that's currently underway. They're independently funded.
Thank you. Thank you very much, Mr. Chairman, and I'm happy to move the pilot at appropriate time.
Mayor Jeffrey.
Thank you for being here today, and thank you for the update, and thank you to Councillor Miles for setting the table. I've talked to staff about this probably for the last 6-8 months or so about the program and how interested I am in having it expanded into Brampton. And the language in the report we have in front of us still sounds kind of tentative. So I'm not tentative, and I'm interested in having staff. So I actually would like to change the motion, Mr. Chair, the last bullet of it, to say that further that staff begin to partner with the City of Brampton on initiating an affordable transportation pilot program in Brampton. Obviously, it will have to go through our council and through our budget, but we're wasting time. We got a lot of people that are not able to get to work, and housing and transportation are the two biggest drivers of people's success. So I think the clock is ticking. I want to be at the table. I want our council to be at the table. We have a lot of vulnerable individuals in the City of Brampton that would be a beneficiary of this program. I want us to be part of it, and I don't want to wait, so I want it to be part of our next budget deliberations, and I'm sure my council will feel the same way. So, Mr. Chair, I would like to move that amendment to the third bullet of the recommendation.
Would you be kind enough, Madam Mayor, just to read it again?
And further, that staff begin to partner with the City of Brampton on initiating an affordable transportation pilot program in Brampton.
Okay, thanks very much.
Thank you.
Councillor Sato.
Thank you. And first of all, I just want to thank staff for meeting with Councillor Parrish and myself a couple of weeks ago on the program and to discuss the report. It was very helpful. Some questions have come up since then that I've sort of been doing a little bit of research on, but unfortunately it's not here, and I didn't get a chance to ask you to bring it forward. I was reading the reports from Halton and York in particularly York, when they brought their report forward, and seeing how they formulated their program. They go from 50 to 75%, and Halton also covers 50% or more, depending on the need. And I don't see that as one of the recommendations here. Also, in York, one of the things, and another item, and I know that will be in the details, but another issue was the length of time of eligibility. For York, I think, had required people to renew every 3 months, and they went back after their pilot and extended it, I think, to 6 months. They were, those municipalities initially were focusing, as we did in our pilot that we approved in 2013, they were focusing on low-income employed members of the community. And I know that that was what we did for our pilot that we worked on with Mississauga and the region. And that was our goal through Ontario Works. And it did miss a lot of people. I think we only had, 200. So we're looking at a project now that is 10 times the size. And I guess if you took the cost, because I thought the $400,000 seemed to be a lot, but it cost us $400,000 that was divided to serve 232 people. And now we're looking at about $1.4 million for 2,500 people. So it seems to be a good cost ratio on that end of it. The recommendation today, I mean, of course, this has to come back to Mississauga Council, and we need to discuss how we actually want to run the program. We have a meeting, Joff, you and Councillor Tovey and I are meeting with the food bank representatives next Monday. to discuss their needs, and I believe there's some other agencies as well. It was interesting that in, I think it was in York, rather than serving those groups through the program, they gave $100,000 annually to the organizations so that they could purchase the bus tickets. So I'd like to, and then, distribute them. So I would like some research done on that. I'm not sure which would be the better way. You haven't spoken about it here, and as I said, I guess as we get into deeper discussions on a program, those are the type of things that we would determine. Where the money is actually going to go and how it's going to be distributed. And hopefully we'll have some feedback after our Monday meeting on how that can work. I'm very pleased to hear the mayor supporting the seniors program. It's a program that Councillor Parrish and I and Councillor Mahoney, I think the three of us all had it in our campaign literature actually 3 years ago. And while I don't run my life based on campaign promises, it is something that I heard from the seniors through the discussions I had and over the years that I've been working with my seniors groups. And it's a program that I feel very strongly about. And I know you're saying to add the seniors in here. That was our initial discussion, was to make them part of this. But that might reduce the benefit that they are now getting. So again, that has to be discussed as well. I applaud the City of Brampton for wanting to come in on this program. You already have your seniors program. You've had it for years. And, so we looked at yours very, very carefully when we put ours in place. I don't think $400,000 is enough money to put in the region's budget. I would have liked, it was my intent when we first started talking about it and through the pilot, when we were having all these initial discussions, Gail, I guess it was my expectation that it would still be a third. I guess I was a bit naive on that one, but I think if we're going to do this, and especially if we're doing it for Brampton and Mississauga, we need to look at a better ratio. And you're going to have to come up with what the cost is going to be, adding the Brampton numbers onto that. So, the $400,000 is going to change anyway. I also think we need further discussion on what the share ratio of costing will be. I guess I'm leaning towards 50-50 cost sharing, because I think the region has a very strong responsibility. And when I say the region, I'm talking about all of us that sit here representing our ratepayers at the region. It's all the same taxpayer. So whether it comes out of the city budget or the region budget is what we have to decide. But I think as far as social services and assisting our low-income families, I think the region has a greater responsibility to cost share than just for the administration costs. So I don't want to pull a dollar value out of my hat today. I think we need to approve that the region will cost share. I think we need further discussion on it. I'd like to approve today that we move forward and including Brampton in on it. But I don't want to restrict us to that $400,000. And that's my concern with approving $400,000 today, is that really sets that number. We know it's going to grow when we add Brampton in, but I think it needs to be larger anyway. So I would ask staff to go away again. I'd like to refer it back to staff and refer it to both municipalities, the report itself. Not approve a dollar value today, perhaps approve in principle, which doesn't set a value. Caledon may have, you may come up with some need as well that, you want to be in on this as well. I'm not sure. I know you don't have a large the transit service, but let the municipalities discuss it, find out what we really need, what we can put into it, and then come back with a full program that we can endorse. So, Mr. Chairman, I know the mover moved the motion, but I would move referral or support in principle and refer it back to the municipalities for discussion and for further discussion on the percentage of cost sharing. And then a report would come back to council with perhaps more meat in it.
David had a comment?
Mr. Chairman, I was wondering if council would agree to approving it today so that it can start with a condition in the recommendation that that staff report back on cost sharing of the actual program. So it would be subject to further amendments related to cost sharing.
That would be fine, but we can't start the program until the municipalities have had our discussion on, with this, I mean, we're all sitting around here, but, I think we need to take another look at whether, I'm not even sure 2,500 is enough. We need to discuss whether we want to put more money into it to serve more than 2,500 people. That's something we have not had a discussion on because we haven't had the numbers before. So I guess, you can approve the program. I don't like restricting to the 400,000, David, and that's where my concern is. We could maybe change it that the Region of Peel contribute funding for the second phase, an amount to be determined through discussion with the municipalities and future approval of council. Or a minimum of 400,000. Would that make you feel better? We know it's going to cost at least 400,000.
If I may, Mr. Chair, the 400,000 is really for the eligibility and the evaluation.
Yeah.
And I think council's discussion now is really talking about cost sharing that $1 million, that the base program, which may grow over time. So we just need to keep the two separate.
Okay, so let's leave that in and then add in another clause that that it be referred to the municipalities for approval and that a report come back to council with recommended cost sharing of the provision of the service. Would that work for you? If the original mover, I think, Elaine, you moved it? Oh, it was you, Gail.
Confused at what's happening here, so perhaps I'll just listen to the rest of the speakers.
Well, I would ask if that would be an amendment to the motion.
But I'll consider that
And it could be a separate amendment if you don't consider it friendly. I think it is, but thank you.
Okay, thank you. Councillor Yaneka.
Chairman, thank you. Support the initiative. I love all the reasons that it makes so much sense to me. It goes back to dealing with young folks and health, and the dollar you give at the front end is the $7 you save at the tail end. It makes complete sense. But on a bigger scale and for a larger discussion that we have to have someday, and I keep bringing it forward, and I'm for the little bit of time that I may have left here and for the rest of you starting your careers, we've got to deal with the elephant in the room at some point. And it's the same elephant that keeps coming up. And this is another example of it, which is the sustainability of programs that we're delivering as cities and as regions that we were never intended to deliver as cities and regions. And the fundamental flaw, this one is beautiful, that speaks to it. So we want to bring forward a program, and what do we need? Well, we need to determine those in need. We're the worst people in the world to determine those in need. I know how it'd be done very easily. Just let me look at all your tax returns. Well, I'm the government of Mississauga. I don't look at tax returns. I just look at the real property you own, if you happen to own any, and I tax you directly on it. You could be rich, you could have a huge mortgage, you may live downstairs in somebody's basement and I don't even know you exist. But the provincial and federal governments know who you are, and they know if you're in need. It's one of the bizarre conditions of our society that, you turn a senior, and by the way, I'll be 55 this year, so I don't know if that makes me a senior in some areas. Suddenly I get discounts when I go to McDonald's. I don't need a discount when I go to McDonald's. But the single mother with 3 kids, she doesn't get a break. But the government knows who she is, not me, they. Fallacy number 1. Fallacy number 2, before Councillor Tovey says it, then the ability to pay. We're the level of government that owns 2/3 of all the stuff and get 10% of all the money. Period, full stop. My house doesn't run this way. If I'm taking my family on a vacation and my 2 boys, who with part-time jobs make 10% of the money, I don't say, where's your 2/3 of our vacation to Florida, kids? They look at mom and dad like we're pretty dumb. They go, you're the ones that make 90%. What the hell are you looking at us for? We do it every day. You wouldn't do it in your normal life. And and I know why. Because we've been abandoned in large part by the provincial federal government. Point number 3, we have God bless our great country, God bless our medical service, God bless our education. We're living longer than we've ever lived. The bad news is a whole bunch of us are going to outlive our money. Another problem. So the dental plans and the housing and all falls on me. Point number 4, you've seen, and I hope somebody challenged me someday. On top of an organization that is the most complex business in the world. Previous to this, I worked on Bay Street as a stockbroker, and there is no company that I ever traded or exists that is in more businesses than the City of Mississauga, Region of Peel. If you want to count them, we're in over 100 businesses, as defined by Councillor Starr, that if I open the Yellow Pages, though I realize they probably don't exist anymore, and say, does somebody as a standalone entity do that? Canlin Hockey Arenas, I was there yesterday with my boy, they run hockey arenas and they make money doing it by themselves. We do it for fun as an aside. When into a restaurant, we run cafeterias for fun. We're in the landscape business, we're in the transportation, and so we have to make money on it. Let's talk about some real numbers now. The number that I always go to when we deal with our budgets, it's I call our staff, is what did we collect from residential taxpayers? Forget what I spend, forget what the other sources. What do residential taxpayers give me in Mississauga for the municipal? $390 million. That's it. I want to solve the housing problem. You know, our 17, 11-year waiting list and the thousands of people that are on it. Well, if I take my $400 million and build a 200-unit building a year at $25 million, I'll spend the whole $400 million, and I've solved 1/3 of the problem. The good news is City Hall doesn't exist anymore because we don't have the money to run it. We don't have community centers. We don't have every other business we're in went broke because I solved some of the housing problem. That's only going to get worse. And I'll conclude with the following. You'll recall when Detroit was going under and Obama was asked, why aren't you going to solve Detroit? The answer that was given was simple. There's 494 other Detroits in the United States. Their balance books are the same. So unlike Wall Street, that was too big to fail, he didn't have enough money to bail out 500 cities. And the biggest cautionary tale of all, and it's my fault for maybe reading and following things too much, did it not strike any of you as actually bone-chilling to me that Flint, Michigan can't deliver clean water anymore? One of the few core businesses of a city and a municipality. And you in North America, the richest country in the world, can't deliver clean water anymore. Happens in the developing world. You know why? Because we're in the other 100 businesses. Said it before, I'll keep saying it till my days are numbered. We need a new agreement with the provincial and federal government so that the people with 90% of the money are paying for 90% of the stuff. We've got to get out of some businesses or we won't be in any businesses anymore and we won't be delivering clean water. Having said that, to the Councillor Parishes, to the it all falls back on us and we want to help and I vote for it too. Your dental plan, what a great success, because the old Yiddish expression, I love it. A drowning man or woman will reach for even the tip of a sword. And that's what it's come to. We're the tip of the sword for these people. We're all they have because they've been abandoned. So this speaks to it beautifully. And I'm going to support it because it's the right thing to do because we've been abandoned by our parents. But the elephant in the room, the game's got to change or we won't be around to deal. And we won't be delivering clean water anymore. And we won't be running a transit system. And we won't be dealing with the core business we were always intended to be. I'm going to leave it at that, Mr. Chairman. I hope I won't have to say it again during this term of council, but every time another budget comes out, it only gets worse because they know where the real money's going in seniors and housing, and they downloaded it all on us, and they gave us the anchor in the equation, and it's going to sink us. Thank you, Mr. Chairman.
I hope you don't say it again because I wouldn't want to cut you off.
Thank you.
But it was very, very well said, Councillor Nathan. Councillor Parish.
I may be grumpy today. But Nando, you've been in this business 25 years, my good friend. And what you should have been doing for 25 years is making this change. And what you need to do is go to the senior level of government in this country and say, we want our distribution of budget to be based on income tax. make us part 3 of your income tax system. It's really nice to do these speeches, but you're talking to the converted here. We all know what our problems are. And you know what? We rise above them and we try to help the less fortunate. Just like the seniors dental program, everybody said, if the province doesn't get into it, we're going to drop it. We're not dropping it. Because there's a lot of people out there that their lives are being saved because they don't have poison dripping down their throats. So stop the speeches. Let's go to Ottawa together. There's the new Liberal government, which I'm sure you'll get along with well. And let's talk to them about doing some transformation to the way we collect our budgets through being part 3 of the income tax system. That addresses your concern, but you can't just talk about it once a year for 25 years. Let's go. I'll pay. Number 2, I think we should approve the $400,000 immediately because they have to get on with sorting through the 2,500 people they're going to choose. If Brampton comes back in 2 weeks or whenever and says, yeah, we want to play 2, then we put another $400,000 in and we double it to 5,000 people. Easy breezy. As far as the 1 million is concerned, 45% of our property tax goes to the region. It should be a 2-to-1 split. Region 2, City 1. That's where all our tax money's going. We don't get to explain it to too many people because some of us pretend we aren't regional councillors. We won't mention any names. But there is a big pot of money up here that our people are paying into. 2-to-1. So hopefully that report will come back the next meeting. But there's no delay. Whenever you start delaying and fiddling and diddling, a program dies. Something bad slips between one meeting and the next, and things go awry. So I think we should approve the $400,000 today. Let these people get on with their job, which is to find the people we're going to put in the program. As far as the senior bus fare is concerned, I'm happy to hear Mayor Crombie's coming around. Took a bet. They are self-selecting. You don't need hundreds of thousands to pick out which poor seniors there are, because they came through the era of the car. I'm one of those, Nando. I'm 69. I came through the era of the car. And as long as I've got a car in my driveway or 2, I'm not getting on a bus. So I self-select. I can afford a car, I can afford the gas, I can afford the insurance, and I'm not getting on your bus. The ones that are getting on your bus are the ones that need to get on the bus. So that's an easy program. Self-selecting, Brampton figured it out years ago, it took us a while. So that is my little rant for today. And I am hoping we pass the $400,000 immediately. And I'm hoping that David Schwartz comes back with a generous offer of 2-to-1 funding from the region for the other $1 million, which may be $2 million if Brampton gets involved. And the scary number for me is the end of this report. It says if we do this for all 91,000 people in Mississauga, it's $28 million. So that's a conversation for another day, and it's a bit scary, and I'm not happy about it, but so be it. Thank you.
Thank you. Councillor Groves.
Thank you, Mr. Chair. We're sort of the ones with no transit system, but we have Caledon Community Services, and if we're talking about seniors, I'm just wondering how that would fit in, and have you given any thought to it or any consideration at all?
It's a fair point.
Through you, Chair Dale. So we are absolutely open to exploring based on the direction from Council. We did talk about Caledon, and because we were still in negotiations with the City of Brampton and they wanted to sort of wait and see the results of the pilot, we didn't take that further. But if you have a specific suggestion, we are open. We are mindful that there are some folks also who need to get to work just north of Mayfield. And we've heard that in our community consultations, that there is a struggle to get, once you go north of Mayfield, that there is no transit. So we're certainly open to that and can follow up with staff as well.
Because those folks that are north of Mayfield that you just talked about are they fit into the students and maybe some of the seniors and some others. Our mayor is on the board to speak, so I'm going to leave it to our mayor to make the commitment But I just wanted to throw it out there that we do have Caledon Community Services
Yes.
that provide those services for seniors. And oftentimes, I've heard from the seniors that it is very expensive for them if they're making 2 trips, whether they're just going to the grocery store or they're going to their doctor's appointment. It is very expensive for them. Sometimes they have to use taxis as well, and it's very costly. So I will leave this to our mayor when he's up next. Thank you.
Mayor Thompson.
Thank you. Doma, thank you for your report. And I'm going to tell you, the Region of Peel has been very good on pilot projects. So I agree. I will definitely support it. And yes, we have a seniors program we work with CCS on. And it's moving seniors and younger adults with disabilities because they developmentally challenged do have work or do have things. So we're there. We have a good partnership with Brampton coming up into the Tullamore. We're working with Mayfield West and our new development. It's all going to be working with Brampton Transit. Question going forward, and Councillor Nika was talking about the elephant in the room, and I think the smaller elephant is really maybe it's time that we all put our heads together and figure out, does it make sense to make this a regional transit system so we're doing the right thing? Personally, I think it should be a greater Toronto area transit system. But reality is we need to step up. We need to be part of it. But the thing is it would be better if it's a regional system. And I think there's some things that the lower municipalities are dealing with that maybe it would be work better at the region. And I'm just wondering, I'm supporting this report, but I'm reaching out back to the CEO and the chairman is maybe we should have a discussion and a report back at some time working with the 2 lower municipalities. And we do have ours where we're not there, but we need to make that next step. Maybe we need to have that discussion. Does a regional transit system make sense? And can we reinvest our money when we collaborate? Maybe we can do more. That's the question I think we need to deal with. Thank you.
We'll take that as direction, Mayor Thompson.
Thank you.
Thank you.
Because we're going under a transit study right now as we speak in
Yeah.
Caledon. So.
No, good point. Mayor Crombie.
Thank you, Mr. Chairman. I'm delighted at the conversation today, and I'm really anxious to proceed with this pilot. So Joff, are we prepared to move on it from our perspective? Is there any reason we need to come back to the city to hash out details, as Councillor Sato was suggesting, or are we ready to go? With, obviously, the details to be worked out by the region.
Through you, Mr. Chair, we just need to finalize the implementation plan, and then we would expect to bring that back as quickly as possible. We definitely want to get on with the program so that we can have the results to inform the 2017 budget process. So time is of the essence, and we will move as quickly as possible.
Then I think we should, incumbent on us to move it today. Now to Councillor Miles, if I may, you've heard the discussion. Are we open to a friendly amendment for an equal funding, or do we want to just go with the 400,000? Did she go back on the board to respond to my question?
I'll just go back on and.
There you go.
After Councillor Sprovieri and speak. Is that okay? Pardon me? Okay. Well, quite frankly, I was still trying to figure out whether or not Mississauga was in or not. So I guess based on the conversation, yes, you're in, you're ready to go, and I'm happy to support that we move forward with the 400,000, because that is what is going to develop the basis for all of us here at the region, whether it be Brampton and Caledon or whatever the future holds. We have to develop the platform in order to run the program, which is what that money is for. I think the subject of who pays has to be another subject. I don't think anybody was prepared to get into that discussion today. Certainly, I hadn't contemplated it as a member of council or as chair of human services because it wasn't on the floor. So my preference would be, and I'm happy to look at cost sharing, and how that works out. But I would like to have the benefit of a staff report and all of the facts. So
Councillor
So-
Miles,
Yeah.
if I may, and to you, Mayor Crombie, we've tried to incorporate the amendments both by Mayor Jeffrey and Councillor Sato. So let me read them.
Okay.
Because we know you have the recommendation before you, and then I can read them. The first one would be what Mayor Jeffrey suggested, and that was, and further that staff begin to partner with the City of Brampton staff to initiate a pilot affordable transportation program in Brampton. And then to try to incorporate Councillor Sato's, and further that the subject report be referred to the area municipalities, and further that staff report back to Regional Council regarding options for cost sharing of the program.
Perfect. I'm happy to move those or to
Okay, so
accept
when it
those
comes time
as
for the
friendly amendments.
Good, I'll
Yeah.
take them as written. Thank you. Mayor Crombie, anything further?
I may. So I think we've heard from Joff that we're ready to go. I don't know that this matter needs to be referred back to the municipality. I want to get it out the door. So I don't really want to amend. I don't accept the amendment that we report back to the municipality. I just want to get it going. I want to vote on it today and let it start.
No, we will be doing that. I think that's to come back. Okay. Councillor Sprovieri.
Yeah, thank you, Mr. Chairman. This is I gotta say, I gotta agree with Councillor Yanika on this one. I think he really hit the nail on the head. You know, you know, it's fine to get into these pilot projects. It's because I seconded your fluoride motion. But, well, no, I philosophically I agree with you, and you know, I understand there's a poverty problem. The problem is it's getting bigger every day, and it's getting bigger because the traditional family unit is breaking down, and as the family unit breaks down, it's going to get bigger and bigger and bigger, and so, you know, it's fine to start a small. You know, I don't have a problem supporting the 400,000, but this is going to be becoming a huge issue, and they're going to come back and say it's working great. We need more money to expand it to more people. And I got to tell you, it's no use going to the federal government or the provincial government because we're running balanced budgets. They're running huge deficits, and they have huge debts, and they can't afford to give us any more money, Councillor Parrish. They don't matter. They just can't afford it. Just for instance, the province spends over and the medical doctor could probably verify, they spend over 50% of the provincial budget on health care. This is where the real problem is. People have to start to become responsible for their health, reduce the health costs, and increase the other services, because there's just no more money in the pot. I agree totally with Councillor Unica. So I'll support this motion. I know that this project will work. I know that there's a huge demand for it. I know that probably you'll be back again saying, you know, it's working great. We need more money to reach out to more people, to expand it. But, you know, I don't know what's happening in Mississauga and Caledon, but my constituents, the biggest complaint I receive, the property taxes are too high. That's what I'm hearing from my residents. And this funding has to come from the property tax. Maybe in Mississauga, people are not complaining. Maybe in Caledon, they're not complaining. But they're certainly complaining in Brampton, and especially in Ward 9 and 10. So, you know, I understand that there's a problem, but like you said, Councillor Unica, we provide too many services, and we're just getting into another one, and we just really, we're really stretched to the limits. And, you know, and that's a problem that we all have to face. And one of these days, we're going to have a revolt like they did in California 10, 15 years ago, where people were just fed up and about their property taxes, and they revolted, and they brought in huge changes. And so I think we're headed in that direction ourselves. So I'm okay with supporting this small amount, but I tell you, we got to be really careful to see where we spend our dollars and how we tax our people, because they're fed up. You know, they're to the limit, and it's going to be certainly in a point where the seniors, they're calling me. Well, I can't afford to pay the taxes to stay in my homes. You know, I can't afford it anymore. I had one constituent, the 80-year-old guy, lived in a house, and he says, John, is you're gonna have to expend that grant you give us, $400 a year, because I just can't afford to pay my property tax anymore. I don't know what I'm gonna do with this. It's, well, why don't you just get a smaller house? Are you kidding? By the time I pay my real estate fees and I pay all the expenses, the lawyer fees, and that it's going to take that much money to get into a smaller house, and I won't be ahead of the game at all. So, I think that we really have to face the reality that we're facing, that we're in, and we have to really start thinking about getting into new programs and new pilots and so on. So I think that, Councilor Unica, I agree with you 100%. Thank you. Thank you, Mr. Chairman.
You're welcome. Councillor Sato.
Thank you. I was just going to speak to the one of the comments in the motion, but I do want to comment on what Councillor Sprovieri said. As regional councillors and as the region of Peel, we are responsible for programs like this. We're responsible for social services, and we're responsible as a regional council. And I want to stress that at the region, for providing those services to those most in need in our community. So that is where the tax dollars from the region of Peel that we collect from our citizens, a portion of those tax dollars are to be directed towards social services. So I don't think we are going off on new programs and new services. We are doing this program is part of what we're all elected to do and why the Region of Peel exists. So with regard to referring it to the municipalities, I did not intend that it be referred so that we do an approval and come back, because I agree I want this to move forward as quickly as possible. But I do think it needs to be referred, the report, to the municipalities so that it can be officially placed on our agendas and we can have some discussion. Brampton, you need to discuss whether you're going to be part of it, so you have to have it referred to your council. Caledon, you need it referred to yours, and I think in Mississauga we need to have it referred so that we can discuss what we are going to potentially ask for in the cost sharing when that report comes back to council. And that's a budget implication in the city of Mississauga, so I think it does have to be referred for that reason. But certainly not to delay anything or for it to, wait for approvals and come back. I agree we need to move ahead with this program. We're only doing our jobs by proceeding with this program, Mr. Chairman.
Then we should look after all that.
Thank you. Councillor Gibson.
Thank you, Mr. Chair. Can we put the motion back up on the board, please?
Yeah, I would ask staff to put it up.
Because similar to Councillor Sato, I think what I'm hearing, and I want to be clear, what I'm voting on today is that we are approving this program. We are approving the $400,000. We've put in Mayor Jeffrey's amendment, which is great, and then we're sending it back to the municipalities to have their discussions. Mississauga is obviously ahead of what Brampton and Caledon did. That's the way I understand this. I've heard there might be some other things. So is that
No, that's correct. That's the intent of the.
Thank you.
Well done.
Thank you.
Thanks for that. Councillor Parrish.
I don't want to get us sidetracked, but I don't want that to stand. Councillor Sprovieri, if the property tax goes on as part of the overall federal tax, it's flow-through. We set our budgets, they collect our taxes, they send it to us, and we don't collect property taxes. It's a very simple process. And what happens is it's progressive. So your little old man who can't afford to pay the taxes on his house is probably earning a very modest pension. He will be paying a very small amount of money instead of what he's paying now on his house tax. So this isn't going to break us. This is actually the best thing that could ever happen to seniors and to old people and to poor people. The more income you make, the more income tax you pay. The more income tax you pay, we set our budgets, the feds collect it, and they send it back to us. And we don't collect property tax. So it's a very simple civics lesson. And I just didn't want to leave that hanging in the air. This is the way very sophisticated countries do property tax and run cities. Thank you.
Thank you. And no, I appreciate Councillor Gibson to bring this forward, because I was going to ask for it to be up on the screen so everybody could get a chance to read it again before we voted on it. So is everyone clear with the recommendation as printed? It was moved by Councillor Miles and seconded by Mayor Crombie. All those in favor?
Recorded vote, please.
Sure.
I think they'll send it through.
Yeah. Yeah. Okay, recorded vote has been asked for.
Yeah, we're okay. Yeah. Got it.
All those in favor, please rise. Councillor Carlson, Mayor Crombie, Councillor Downey, Councillor Fonseca, Councillor Gibson, Councillor Groves, Councillor Ianica, Councillor Innes, Mayor Jeffrey, Councillor Kovac, Councillor Mahoney, Councillor McFadden, Councillor Medeiros, Councillor Miles, Councillor Moores, Councillor Paleshi, Councillor Parrish, Councillor Raz, Councillor Sato, Councillor Sprovieri, Councillor Starr, Mayor Thompson, and Councillor Tovey. It's unanimous.
Well done. And before the two of you leave, Adom, I just want, on behalf of Regional Council, thank you for all the good work that you do with and for the community on a day-to-day basis. And Joff, it's great to see you here again. I miss you as well as many other of the staff members at the City of Mississauga. And I commend you for working with the region on this project and the Phase 2 of the project, and keep up the good work. Good stuff. Thank you. As Councillor Ianica had noted earlier, Mr. Fazzillo had withdrawn his deputation, so that takes us to items related to enterprise programs and services. Councillor Fonseca, if you would chair this section, please.
Thank you, Mr. Chair. Item 6.1, and I think we could also move up 6.3. They're related. Item 6.1, that was a request to have this report brought back from 2008, a report titled Reinvestment of WSIB Surpluses. This is for information. And also 6.3 is a reinvestment of Workplace Safety and Insurance Board. It's also for information, WSIB surpluses. And it's a follow-up on the 2008 Council report, and 2011 Council report. Councillor Parrish.
Thank you for bringing it forward. One of the things I was presented with was the book that we purchased. It turns out it's a little glossy pamphlet. I don't know if everybody's seen it, but this is what some of the money was spent on the Temaconter Memorial Trust book. So I'd like to take this opportunity, because there's also a letter here from Bonnie Petrie, the Secretary of QP Local 966, because I did talk last week about trying to bring in a staff relations committee, and I did have a motion drafted. I am thinking that this is very shark-filled waters, in that we have negotiations, we have bargaining units, we have all this stuff. So I would like, if the rest of council agrees, in the whereases in my motion, which is just to build the type of committee that people can sit around more informally and talk about issues like the structures that they want mechanized, and have the staff bring us back a rough idea of what they'd like to see if, in fact, everybody else wants to do it. I think things like the WSIB funding, I think staff that are actually on the job, especially the paramedics and all the people that we've been experiencing a lot of difficulty with lately, not with us, but with generally their job situations right across the province. I think if we could put together a suggestion that's from the staff, our senior staff, that says this might work, let's have a look at it and bring it back, rather than discuss this motion today.
Rather than your motion?
Yes.
Okay. Yes, David, yes.
If I may, Madam Chair, the original report back in 2008, I believe, if memory serves me correctly, came out of discussions at the Joint Health and Safety committees in long-term care and also in paramedics. And the concern back then, the primary concern back then, was on musculoskeletal injuries in working in both. It was a longer term concern that had been identified in our long-term care facilities, and it was an emerging concern, I believe, with the paramedics at that time. And it was actually the discussions in those joint health and safety committees, which are mandated by legislation and part of our collective agreements, that led us to bring this report to council to recommend the reinvestment of some of our workplace health and safety insurance surpluses.
I guess what I'm getting at is we have just come through strikes. We do have some members of some unions contacting counselors. It's a very informal way of dealing with this. I was hoping that at some point we could open up a discussion, because it's not just going to be paramedics, it's going to be other QP branches that have concerns, and not necessarily ones that are discussed at the bargaining table. This model is taken from the Peel Board of Education, where in fact we had regular meetings and we discussed a lot of little issues before they became big issues. It went on to put counselors actually, or trustees, on the bargaining units, which I would never in a million years recommend. But what I know I'm looking for in this is some sort of communications situation where we talk about small problems before they become big problems, and we don't just focus on paramedics, we focus on any of the groups that are coming to us. If the rest of council doesn't want to do it, that's fine. But I think there is a place for it, and I think as long as we keep it outside grievances and outside the bargaining table, I think it would be a valuable way to show our staff that we're all interested in their concerns, and they don't have to contact us as individuals. They can bring their small concerns that are outside the bargaining table to a committee like this. But as I said, if everybody's not enthusiastic about it, then don't waste your time trying to draft something better. I base this on the Peel Board.
Okay, so Councillor Parrish, as of right now, you'd be willing to move the 6.1, 6.3, pull your motion off the table with direction to staff to come back with more
comments.
information. With comments. That's where you're.
Is that okay, David?
Okay,
Okay,
so,
that's what I'm doing.
Okay, so then we will continue to move through the list. So, Councillor Groves.
Thank you, Madam Chair, and through you, thank you for the clarification. So I was going to speak to Councillor Parrish's motion, but it's off, and I'm fine with staff coming back.
Thank you. And Councillor Miles. You're done. Oh, are you done, Councillor Groves? Yes.
Yeah, thank you very much. Well, quite frankly, I'm not enthusiastic about this motion, so if Councillor Parrish wants to know, I think I think this kind of committee is really setting up members of council, quite frankly. I think that the role of a member of council is a director of a corporation, and we hire and pay staff throughout highly qualified staff to deal with the administration of the Region of Peel. And this is administration, this is staffing issues, and it's a real slippery slope. We do, as a Region of Peel, have a number of employee relations committees. Mr. Swark, sorry, could you explain to us what kind of actually health and wellness and employee relations committees that actually exist today in the Region of Peel that provides opportunities for staff to bring forward their ideas, their initiatives?
Through you, Mr. Chair, yes, I can. And I'll ask Mary Cleavey, Director of HR, to jump in if I miss some. On the bargaining side, the employer really has the responsibility to treat the union as the exclusive representative of these employees that they represent. And that relationship between the union and the employer is described in our collective agreements, which are negotiated with the union and amended from time to time and approved by council. In those collective agreements, there are a number of different processes. Some are legislated, some are guided by jurisprudence over time. The most common one is the grievance process. And the grievance process actually starts with the supervisor meeting with the employee on whatever the issue is and trying to resolve the issue informally. That's the basis of the dispute resolution process. And then if they're unable to do that, then there are a whole series of steps that they move through all the way up to the Ministry of Labour to get that particular issue resolved. In addition, if either party has a policy issue, they can raise it through that process. So in addition to that process, there are also some committees. There's joint health and safety committees, represented by both the union and management. And there's also labour management committees. And in those committees, as well as in the grievance processes, the unionised staff are released from their work as regional employees so that they can do the work required under the collective agreement to make that collective agreement work. If those processes don't work, if they break down or either party feels they're not working well, the Ministry of Labour offers training, mediation training. They will actually send mediators in to try and make these processes work so that issues that have prevented them from working in the past can be resolved. On the non-union side, we have similar committees, and I'm going to ask Mary to, because I'm drawing a blank. We certainly have similar processes related to what we'd call grievances. We have policies of the organization that allow non-union employees to raise issues with their supervisors and follow that through all the way through to me. And as for committees, maybe Mary, you could jump in.
We have corporate committees related to employee wellness, but the complaint process that David spoke about does allow employees to bring forward their concerns to the appropriate level of the organization.
Okay, so
in addition, on both union and non-union side, we also have committees like the black. Sorry, I'm drawing a blank. They're not called committees, but
we have a number of employee networks that exist within the region where employees can bring issues as well.
It allows employees with a community of interest to identify issues within the organization and bring those issues forward for resolution.
Okay, I guess just in summary, I have had a bit of a lesson in the last few days around the Municipal Act and the role of council and the role of administration. And what the Municipal Act actually does is it requires us by legislation to set out policies as a municipality, the region being, that clearly defines the role of council and the role of administration. And I think that a committee like this would be directly in conflict with the Municipal Act and the policies that we have adopted by council in regards to delegation of authority of administration, et cetera, et cetera. So I don't want to send staff away and spend a lot of time developing a terms of reference for something that I don't believe is appropriate. Thank you.
Okay. So thank you, Councillor Miles. So are you saying, so Councillor Parrish has pulled her motion, but she's asking for some further report, further information from staff. Are
My understanding of what Councillor Parrish said is that she's pulling the motion, but she wants to leave in the whereases, and what the whereases does says that that council and staff are going to meet on an ongoing basis with the union. And I don't know how you can't deal on a one-off. You just can't deal as council on a one-off. Somebody's going to come to me. I'm going to be sympathetic, and then I'm going to want to do something. But I don't know the big picture because I'm not dealing with all of the different unions in the municipality. I don't have the expertise to bargain, and quite frankly, it's not my job. My job is to sit here and set policies and make sure that I have the staff to do the job. And so I don't like it. I don't feel right about it. So I don't support taking it any further, quite frankly.
Okay.
Sorry, Madam Chair, point of order. we're getting into a
Yes,
discussion on this, and I'm going to declare a conflict of interest because this does, Councillor Parrish's motion involves
has been.
non-union as well, and I'm starting to feel uncomfortable. The clerk said we weren't voting on those whereases today, but I'm going to leave the room as I have family working for the region in non-union side.
Okay, so just for clarification, I'd asked it before, but just, and thank you, Councillor Sato, but just for clarification, Councillor Parish, you've pulled your motion completely, and you have just asked for staff to bring back a report, correct? So there should be no further discussion on the motion.
Correct.
Okay, I'm still feeling uncomfortable. I'm going
Okay,
to declare a
okay,
conflict of
okay.
interest.
And on a point of order, Mr. Chairman, I'm going to follow Councillor Sato's lead on that, as well as I have family working for the region as well.
Okay.
Okay, I just.
So are we getting into non-union discussion?
We are not. We are.
Thank you.
As stated and asked for clarification now twice by myself, the motion has been withdrawn, and the request is for further information from staff, a report to come back. That's it. So we're not discussing the motion or any of the whereases because the motion has been pulled.
So how do we determine as a council? I don't support the direction to ask staff to come back with a report on this subject. So how do I do that?
So Councillor Parrish's direction, she has moved the two, or she's moving 6.1 and 6.3 for information with direction to staff for a report to come back for further information, and has pulled her motion.
Actually, Councillor Fonseca, if I could help, I think it'd be more appropriate if that was put in a motion, and then Councillor Miles
Okay.
could vote against the motion rather than
Okay.
have it as direction. Just full
Okay,
suggestion.
so Councillor Parrish should be putting the motion forward for a report.
Can I listen to the other speakers first, and then I'll
Yes.
put a motion on the floor?
Okay. You're done, Councillor Miles? Okay. Mayor Thompson.
Thank you. Councillor Miles, you're quite right on the Municipal Act, and I just came back for the Rural Municipalities of Ontario, and Fred Dean and Nigel Belchamber are kind of the experts advising municipal councils in their role. And the one thing when I spoke to them yesterday about this time, I asked them just the what ifs. They're quite concerned about our role. If you start to step out your role as an administrative counselor, starting to get in the role of management, you automatically assume the liability. The municipality no longer covers you, or the regional covers you in case someone is really unhappy and comes after you. Why do I want to sign up for that? So I think we need to know our roles are really defined. We do our roles, we do them well. Let the management, if the management's not doing it well, then we're not doing our job making sure the policy's working. So I really think we better understand our roles and not get ourselves into a whole soup of nuts that we do not need to get into. Trust me, right now with liability, I'm living that. So I don't think it's fair for our council members to get into something like this, putting our municipalities into something like this, and even our taxpayers. I really think we need to really be careful on how we define our roles and what our role responsibility is. So if something does come back and does get supported, Councillor Parrish, I really need to know what risk we're putting ourselves into. I think that is the key thing that we need to really understand here. Okay, thank you.
Councillor Groves.
Thank you, Madam Chair. I agree and concur with the two speakers, Councillor Miles and Mayor Thompson. I don't think it is our role. I do think it's a very slippery slope. I think we do have staff here that have the expertise to deal with these types of issues. And at the end of the day, our staff, they do come back to us. So we are always in the loop. But I just want to have some clarification from staff, and maybe the CAO can clarify for me. I know the motion has been withdrawn, but I just wanted to know from staff about bringing anything back. Like, I'm not sure what purpose it serves. I don't know.
Through you, Mr. Chair, in a very narrow interpretation of your question, Council may pass a motion that we bring back a report on putting together a committee. I believe that, and Councillor Parish recommended, a committee with councillors and non-councillors for resolving issues as they may arise, is how I understood, but the motion hasn't been put forward, so.
Okay, I'm going to wait for that motion to be put forward because I wouldn't even support staff going back and bringing a report forward in doing this, because that report will basically say everything that the motion is stating. So I'll wait for the motion to go on the table.
Mayor Crombie.
Thank you. I want to first commend Councillor Parish because I know the spirit in which she's trying to do. You know, she knows that dialogue is better than no dialogue, and if we could have people at the table regularly just talking, that could avoid a lot of problems. But I think there are some issues that have been pointed out that may be problematic. So actually, I just wanted to ask Patrick maybe for a little legal opinion on, you know, what were the liabilities if we would proceed with something like this?
Firstly, as to the Municipal Act does envision a division of labor between council and management along the lines that Councillor Miles has spoken to, but I would not agree that it prevents the establishment of a committee of this general kind. If establishing a committee of this general kind, there are risks that are entailed with that, that I think Councillor Thompson is alluding to. They are chiefly around the areas of avoiding intervention by the council in matters provided for under the collective agreement, such as grievance issues, and also intervening in the collective bargaining process. There are problems if council is taking on that type of role, which becomes a kind of management role. As for liability risk, I would see that as chiefly a risk to the regional corporation, not to councillors per se.
Thank you.
Okay, thank you. Councillor Toby.
Yes, thank you very much, Madam Chair. I can't possibly agree with this. I don't see even any use in sending this out for a report, to be honest with you. This is not something we should be involved in. The CAO's outlined very well how we have very good agreements within the collective bargaining agreement that provide for any sort of discussion that should be had. It's been mentioned that the Municipal Act could also, Conflict of Interest Act could also be an issue for us. So I would like to put a motion on the floor that we shelve this entire idea. We do not ask for a report, and we do not revisit this conversation this term.
Okay. So, yes, Councillor Medeiros.
Thank you, Madam Chair. Regarding this, I agree with Mayor Crombie and when spoke to the intent. You know, I think what Councillor Parish and what I heard and what I've experienced as well, and her, I guess, contextual, when her providing the context in terms of what she brought this up, was in fact that we do have these one-offs. We do have informal conversations with, or we are approached by the various union memberships, and so my understanding was provide some form of structure, some form of opportunity, some form of transparent public space to allow these type of conversations to happen instead of having these one-offs with various union members. So the idea is that, certainly this doesn't stop us, for us moving on and meeting with union members and dealing with issues, because they're our constituents. I certainly, I'm always open to meet with my residents who belong to QP, and more so, I applaud Councillor Parish not only for the spirit but the idea. And I think in this way, it's just an opportunity to provide that in good faith. And I think she was very, and I'll let her speak after, but she was very specific in saying that we would try to avoid staying away from any collective bargaining ramifications. We are dealing with, small issues that instead of percolating, that they feel that they've had that opportunity to speak with us. And it's within a structured environment. So there's not these speaking to councillors in various ways, and it allows an opportunity that there's a forum that all of us can participate in this type of committee. So I think there's merits. I think there's merits to looking at this, reviewing it, and all we're trying to do is get some staff comment, provide some, information. And if the information comes back that thou shalt not because of all these reasons, I think, we would accept that. But I think there's merits into looking at the issue. Thank you.
Thank you, Councillor Medeiros. Okay, Councillor Tovey has put a motion on the floor, so we would need a seconder for that. Councillor Groves. And then to Councillor Carlson.
Thanks, Madam Chair. I'll just change the text from support of parish motion to against Tovey, so I'll make it easy. Having served many, many years in the Peel District School Board in charge of this area, and on the library board, Mississauga, where we have this committee and have had for as long as I can remember, when union association groups come forward, these are kind of the stories like this is what we're doing. I'll use a library as an example. At the branch level, we're doing this in Streetsville and this in Lauren Park, and then we say, well, how would this kind of work if we on the book return or some little operational things that come back and forth. We do it at the first of the meeting, and I'm not on library board anymore, but I'm hoping that they still do this exact same thing. So you kind of work out the small day-to-day stuff. It provides an opportunity for staff to say that this is, after all, local government. Chance to speak to your local councillors. It seems very important to union association members, but once in a while to say whether they come here and make a little presentation or they meet with groups of councillors. It seems to be an important thing, and there's a feeling, certainly a sense in this organization, that there's institutional resistance to meeting with councillors, which I don't experience that at Mississauga because we're there all the time, and here it's sort of that every Thursday. So I personally think some iteration of this is a great idea. In terms of keeping in touch with our valued employees, just little coffee chat, if you will. You clearly have to stay away from grievances and and hirings and firings and all the usual stuff. But at a certain point, it just becomes a conversational. You pick a little bit of the culture, what's in the air these days, and it's a way to impart some information. Too bad about the economy, maybe some of the settlements are a little high across the country. It's just a little way to have a chat. Now, I never had any problem with doing that on the Peel District School Board for years and years. So, but I'm not clearly nobody here is really interested in it. But it's not the negotiational boogeyman. I mean, let's not turn it into and to be liable personally. I mean, that's laughable to be. Obviously, we're covered by our insurance. Patrick gave good explanation, but whether you want to do it or not, it's up to council. But I certainly have no problem with or no fear of talking directly with groups. We do it informally, so under transparency, maybe we're doing it the wrong way now. So should think about that a little bit too. But anyway, I'll be voting against Mr. Tovey's motion, and hopefully someday we'll see the merit in a proposal like this. Thank you, Madam Chair.
Okay, thank you. And Councillor Parrish.
Yeah, I'm not going to live or die on this hill, but the point is, the whereases I thought were very explanatory. If I were going to be allowed to put a motion on, which I thought I would be allowed to before Mr. Tovey put his on, I would have said, therefore be it resolved, the parameters governing staff-council relations as described under the Municipal Act be reported to council at a future date, and further, the possibility of a committee involving councillors and staff to discuss the healthy functioning of the region and its constant improvement. Now, if you come back and say it can't be done, that's a very sad day for us. We cannot have meetings in the open, as Councillor Carlson pointed out, instead of meeting in coffee shops or down in Mississauga in my office. I would like this to be somewhat similar to what we did on the Peel Board, both of us being there. Elaine was there. What happened there was very casual. It was a monthly meeting. It was talking about how things could be improved. It never got into the negotiations until it became the negotiation committee. I don't think it's healthy here. We have been through a strike. I've made it very clear to staff I don't like the fact we hire hotshot outside lawyers to do negotiations. We don't do that at Mississauga. We have staff people, and they're not even lawyers that negotiate with all our groups, and they get along well. So there's something not quite right here. And to have a request for stretchers in mechanical stretchers in a 2008 report, and we're just now in 2016 doing an RFP for them, there's something wrong there. but I'm just going to read it to you one more time. Therefore, be it resolved, the parameters governing staff-council relations as described under the Municipal Act be reported to council. It's a report. And further, the possibility of a committee involving councillors and staff to discuss the healthy functioning of the region and its constant improvement be reported. Now, if we're afraid of a report like that, then that's fine. It just seems shocking to me. I don't work like that. I'm a very open person. Anybody can come talk to me. I just thought we would institutionalize it.
We have a motion on the floor. We're supposed to be discussing the motion. You're not allowed to. You're not allowed to read a motion out while there's a motion on the floor.
So,
That's right. She has it
so,
first.
okay, may I ask the clerk? So Councillor Parrish had removed her motion, asked for direction. We told her that it should come forward as a motion. Then she listened to the speakers. Then Councillor Tovey's motion came forward first, so or put his motion forward. So can you, so far, so it is the motion that stands right now on the floor.
It's the only motion on the floor.
Yeah, thank you.
Okay, and we have a seconder for that motion, Councillor Groves. So we need to be voting on that motion. So can you read your motion again? And we do have one more speaker.
Yes, actually, I'd like to speak to it again. The motion is that we do not ask for a report from staff on this, and that we do not revisit this topic this term of office. It's very simple.
Okay.
And the reason for that is that, unlike the school board, we have completely different collective bargaining agreements. We already have all of what Councillor Parrish is talking about already laid out in our collective bargaining. And if we set up another committee to even start to interfere with that, we could be putting those collective bargaining agreements in jeopardy. I think the CAO has already outlined that very, very clearly. And then there is a slippery slope as far as the Municipal Act goes, so it's not something we should be involved in. So that's why I put the motion forward.
Okay, thank you. And Councillor Sproviero, you're speaking to this motion?
Yes, yes. I don't support the motion before us. I think there's a merit to explore the issue, and I think we should go through that exercise. And so this motion would prevent that from happening. So I certainly can't support that, and I will be supporting if this fails, I'll be supporting the other motion that's been proposed. Thank you.
Okay, thank you. So there's a motion on the floor, moved by Councillor Tovey, seconded by Councillor Groves. All in favor? Oh.
Recorded vote.
Okay, so the motion on the floor, moved by Councillor Tovey, seconded by Councillor Groves. All in favor?
Councillor Gibson, Councillor Groves, Councillor Ionica, Mayor Jeffrey, Councillor Mahoney, Councillor Miles, Councillor Raz, Mayor Thompson, and Councillor Tovey. All those opposed, please rise. Councillor Carlson, Mayor Crombie, Councillor Kovac, Councillor Medeiros, Councillor Paleshi, Councillor Parrish, Councillor Sprovieri, Councillor Starr. It carries.
Thank you.
Okay. Okay, thank you. Moving on to item 6.2, the minutes of the audit committee. Moved by Councillor Medeiros.
Actually, Councillor Fonseca, if you don't mind, we need a seconder for 6.1 and 6.3.
Oh, yes, sorry. So move receipt by Councillor Parrish, item 6.1, 6.3. Could we move the correspondence at the same time? It was referred to Okay, and 7.2 correspondence, moved by Councillor Parish, seconded by Mayor Thompson. All in favor? Any opposed? Carried. And then moved on to item 6.2, it's minutes of the audit committee, moved by Councillor Madero, seconded by Councillor Ross. All in favor? Any opposed? Carried. And back to you, Mr. Chair. Sorry. No.
Councillor Fonseca, yeah.
There is 7.1.
Okay, Councillor Yanika.
Regards to 7.1, I see it requires direction. I had a tough morning of tough decisions. This is an easy one. What a privilege that the chairman of the board of the Royal Agricultural Winter Fair is requesting an appointment of one of our members to sit on their board. And sometimes you get really easy decisions, and I'd be honored if Alan Thompson would take that privilege on behalf of us. I think he's the most suitable person by far. I haven't spoken to Alan, but if he'd be willing to stand, I'd be honored to have him there. He's perfect. I would
Okay,
so move.
thank you. So moved by Councillor Yanika, moving receipt of the communications and moving
Yes.
that Mayor Thompson. Moving that Mayor Thompson be.
We won't pass this to the fair.
Just a horse ride.
Okay, moved by Councillor Yanika, seconded by Mayor Crombie. All in favor? Any opposed? Carried. Congratulations, Mayor Thompson. Now back to you, Mr. Chair. Thank you.
Thank you, well done.
Thank you. Sorry about that.
That brings us to items related to Public Works. Councillor Starr, if you'd chair this section, please.
Item is professional engineering services in the city of Brampton. You have the documentation in front of you. Are there any questions or comments? Seeing none, moved by Councillor Sprovieri, seconded by Councillor Maderos. All in favor? Carried. Second item is engineering services for various pumping stations. 5 of them. There are 5 separate assignments on this one. You have the report in front of you. Any comments? Any questions?
I'll move it for you.
We'll move actually with the area councillors that are affected the most. Okay, Councillor Thompson, Councillor Rass. All in favor? Carried. And the updates to the basement flooding remediation program. I don't know, are you going to speak to this, Dan or Mark, or does anybody want to hear a short presentation?
We don't have a presentation, Mr. Chairman, but we'd answer any questions that members of council have.
Councillor Rass.
Thank you, Mr. Chair. Thank you, Commissioner Lebrecq, for the report and to Mark. I really appreciate the fact that we've taken a second sober look at this. I know that there were some implementation issues. I do have some questions. Did we not consider, I know there hasn't been huge uptake, but did we not consider the voluntary downspout disconnection program to end at the end of 2016? That would be aligned with the backwater valve rebate program. I think as councillors, that's an easier one to communicate because sometimes it should probably be more aligned to the calendar year. It's just easier if it was consistent. And I know if there's not a huge uptake, then there's not going to be a big financial implication as a result of that. So can I have your comments on that?
Yeah, through the chair. We decided on the backwater, on the downspout disconnection rebate program. We would just let it run out because it was supposed to go to July 1st, 2016. So the intention was not to go out and advertise it, but some residents are still making applications, so we would consider those applications. We've had some residents ask us to extend the backwater valve program. So we decided it was probably in those residents' interests, and that seems to be the one we're having more uptake on. Certainly because the insurance companies are starting to request it, that we extend that and end it at December 31st, 2016. That's why we extended that program specifically, because we were getting a need from some residents through their insurance companies that say we need to do it.
Okay, but from an implementation perspective, it's easier for us to communicate if both programs kind of get completed at the same time. It just makes our lives a little bit easier. And if there's not a huge uptake on the voluntary disconnection program, what can we do to make sure that that ends the same time as the backwater valve program? For a lot of the products that we put out, they need to have a longer shelf life, and when we're talking about the same program, I think that there should be beginning and end dates of similar programs to be aligned.
Yeah, that's fine. We can accommodate that then.
Okay, so am I taking yes for an answer?
We could amend the third clause to say December 31st.
Wonderful.
And include the, make it that it's the backflow prevention and the disconnection program at the same time.
Yeah, I know you guys live this program every day and it makes sense to you, but for the average homeowner, they don't necessarily understand the difference between the two. It just really helps in the communications. My other question, you okay there, buddy?
Yep, I'm good.
Okay. When did we know that the region does not have the authority to impose a disconnection, as the connections are subject to the local municipality's stormwater-related bylaws? So we moved forward with this program a number of years ago, I guess. When did we figure that out, that we're trying to make a mandatory program mandatory, but don't have the authority to do so?
So we've always known that.
Okay.
We've been working with the city. What we didn't expect to find was that a lot of the pre-1975 homes, the 63,000, we were having problems confirming that they were actually connected only to the sanitary. What we were finding out was, through our smoke testing program and in additional discussion with the cities, that I guess as communities started going away from, towards curb and gutter, away from ditches, somewhere along the way, homes were starting to connect to the storm sewer. So the numbers became smaller than what we expected. So when we initially when we went in on the pre-1975 homes, we believed that the bulk of them would fall under our sewer use bylaw, and we wouldn't have to get involved in the storm sewer use bylaw. That's probably been the biggest finding that we've come out of this, and we don't have the right under the Municipal Act to make it mandatory if it's under the city's bylaw. So in discussions with the city, we decided it was probably easier just to go in and deal with the ones that we had confirmed and eliminate the mandatory program.
Okay, thank you, that's good to know. And my only other comment would be on page 4 of the report, you say potential future avenues of communication, one of them being letters to impacted property owners. And I would actually, rather than that be a potential, I think that should be a given. So if
Yes,
you can
it
please
is.
consider
Okay,
that.
that's fine.
Okay, thank you very much, and I appreciate the work that you put into this.
Thank you. Councillor Miles.
Thank you very much. Mr. Scheller, could you explain to me, to disconnect from the downspout where it goes into the sewer, is it just a matter of changing your eaves trough pipe that comes down, just taking it out of the ground?
Yeah, there's two things we would do. We would disconnect the pipe that starts going into the ground and take it away, convey it away from the house. And we would also cap that section of pipe that goes down into the foundation drain, so there's no surface water that'll enter in at that point as well. In most cases, it's relatively simple and inexpensive to do. The challenge we have is with landscaping. And we also don't want to make it unsafe where they could have winter freeze up from icing conditions. But it's generally a pretty simple practice, and it's about disconnecting it on the outside of the house where that metal pipe and quite often enters going into a plastic pipe that you don't see going down into the ground. In some places, pre-1975, they could be a clay pipe sticking up above the ground as well.
Okay, so if that's the case, why are you projecting it to cost between $500 and $1,000 per household?
Because what residents have been telling us when they've gone back to get contractors to do it based on different things around their landscaping, it is costing more. That's an estimate we've put in. In some cases, it may only cost us a couple $100. Based on some of the work we did in Park Royal, sometimes the costs are as high as $1,000 based on landscaping that is around the house. And to make sure we redirect it to a proper location, sometimes we have to do some additional work with their eave troughs to redirect it to another corner of the house so we can discharge it.
So how do you monitor that?
Well, what we're proposing on doing is only going in and right now we've identified 1,000 properties. We would go in with a contractor, offer that service to the resident, and we would pick up the full cost and then keep track of what the work we've done. It's almost a case by case.
Yeah, I understand. I'm just trying to figure out the logistics and how you monitor. You know, at least with the rebate program, people do the work. They usually do it at the least cost they possibly can. They give you the bill and you rebate them, whereas if we're going to have a contractor, it's in the contractor's best interest and the resident's best interest to get as much as possible.
Yeah, we'll be working with the contractors to get those prices on an individual house-by-house basis. And actually, in a lot of the areas, I'll use Malton as an example. Right now, we've identified 285 homes that we have to do in Malton. We'll probably put that out. We'll go in and do the investigation on what needs to do, and then we'll tell contractors this is the type of work we're looking at doing house by house. The important thing on this, we're offering the service to the resident at full cost to us. If they decide they don't want us on their property, then at this point, we won't go ahead with the work, but we'll know that it has been offered.
Okay, so there are some homes I know in my ward that has experienced flooding, flooding, and we have asked them to participate in the Disconnect program. I don't know if they have. So are there some of the flood-prone areas in Bramalea included in this 1,000?
Not right now. So part of the report, we say we're going to expand our smoke testing program. We have done some smoke testing in the Brampton area. So I just don't have the numbers here right now. But if we've identified a connection to the sanitary, those homes will definitely be offered. For areas that we haven't done smoke testing, those will be done over the next couple of years as we find more connections.
Okay, so if my memory serves me right, though, we did do smoke testing in some of the areas where the downspout was connected.
Yes.
But you're not offering it to them?
No, it will be offered to them.
It will be. It's part of
Yes.
the 1,000.
No, it's actually not part of that 1,000 right now.
Why?
Just because we haven't formulated all the numbers. It's part of our current budget. So if there is a series of homes, it'll still fall under this program.
Okay, but my concern is, who are you offering this to?
Only to the residents that we've been able to confirm through smoke testing that they are definitely connected to the sanitary sewer.
Okay, so, sorry, if we're going around in circles, but there are areas that you did identify after the last storm in Bramalea where you did the smoke testing and you did find that they were connected. So are they going to be on your list?
Yes, they will be.
They will be, okay,
Yes.
thank you.
Thank you. Councillor Fonseca.
Mr. Chair, and thank you for for this bringing this report back. Lost my train of thought. So you have in here, with regards to the smoke testing, expanding the program to spring of 2016. Is that it, or is that enough time? I know the smoke testing that was done, I don't know if it has been completely in Ward 3, but did that not take 2 years or 2 seasons to do just in Ward 3?
So
is this
in-
enough time with regards to the smoke testing?
So in Ward 3 right now, we've actually done approximately 12,000 homes of smoke testing, and so far we have found 432 connections. So as part of that 1,000 I talked about, there's 432 homes in Ward 3 that will be offered for us to come in and do that disconnection at our cost. We do have lots of other areas still within Ward 3 and lots of other areas on the west side of Peel and other parts of Brampton and Calvin. We still have to go in and do smoke testing. And that program will start the spring of this year. And as we find them, we'll add in those additional homes in subsequent budgets going out.
Okay. So when you say spring of 2016, it's not, there could be additional beyond, smoke testing could go beyond, could go into 2017 or 2018. That'll come up at another time.
Yes.
Okay, and with regards to the communication around the smoke testing, having gone through that with residents in Ward 3, could there be, just as in terms of notifying the council, you recognize, or you note in here that there will be ongoing communication, but can you send whatever notification you put out to the residents, can you also send like a bullet point fax about the smoke testing that could go to those, that we could have as councillors to be able to speak to residents about when they call? I recognize that communication went out through your office, but there's still residents that contact concerned about the smoke testing that for whatever reason haven't read what is going on in their neighborhood. So that would be helpful.
Yep, we can do that. I think the other important part about the communication on the smoke testing, we work actively, very closely with the fire department as well.
Okay.
So they know where we are street by street, because sometimes residents get smoke in their homes. And the first thought is that their
Yes,
house is
that's
on
right.
fire. So we
That's
actually
right.
have ways of confirming it at the same time they're dispatching 911. So.
That's right.
So we work very closely with emergency services.
So just, my ask is just as you're sending notice out to a neighborhood, if you could make sure the counselor's office is copied on that.
Yes, we will.
I had one other question, just with regards to multi-residential updates. I have multiple, I'm sure in other wards, but I have multiple multi-residential that were built pre-1975, and you were going out and working with them kind of individually on how to disconnect or how to deal with their sites. Have you completed that, or could we be provided a list of where you have gone? Is that possible to get that? I'm still getting questions from townhouse complexes and condo complexes that were built either right pre-1975 or in the late 70s, where they're still concerned about how to go about addressing their situation if they're still experiencing flooding. And they're experiencing both sanitary and overland flow flooding.
So we would deal with those just like a residential request at the same time. So we're more than welcome to go in and deal with the condos and then the sort of the townhouse complexes. We've had some refuse us to help based on their board not wanting us to come in and do any work, and that happens. So.
Okay, thank you.
Thank you. Councillor Mahoney.
Thank you, Mr. Chair. My question's around communication as well, specifically to the downspout disconnects. I still get calls from residents. I know we sent out some communication door to door to residents saying that the program is going to be mandatory, as we've now kind of evolved into being voluntary. So my question is, do we have a plan to communicate back to residents saying that it is, in fact, now a voluntary and not a mandatory program?
We're working on that right now, but we are going to tell them that the mandatory program is not going forward. So.
Okay, and will that be a similar mail-to-mail or door-to-door delivery?
We'll have to use a bunch of different media to communicate that. You know, even with our uptake, you can see how low our uptake has been, so it's going to use a wide range of different media in order to communicate to residents and into your offices as well.
Okay, I appreciate that, because like I said, I still do get calls from people saying, you know, we're going to get fined and what do I have to do? And so we explain it through our offices, but any update on the communication to council would be great.
Okay, thank you.
So with that, you're moving that, Mr. Mahoney, or Councillor Mahoney, seconded by Councillor Fonseca. A quick point on that communication. If he can maybe bring back something to us, letting us know eventually what the plan is, et cetera. Kudos to the engineering staff and the people I talked to. We had maybe a potential situation where the contractor wasn't happy and all those things, and worked with staff, contractor worked with staff, and I think Councilor Yanika alluded to it, but I want to tell you that I was impressed with the fact that we were able to go through all the details and back and forth, and to the point that it was a satisfactory resolution to everybody. So I just want to make that public, and thanks very much. Back to you, Mr. Chair.
Thank you. Items related to health, Councillor Moore, if you chair this section, please.
Thank you very much, Mr. Chairman. Did we bring forward 9.1 when we had the delegation? So that's been dealt with. The next item are the minutes from the Health System Integration Committee, moved by Councillor Sato. You were there. You have a question on that as well? Thank you.
Thank you. I just wanted to draw council's attention to the fact that this report from the committee, we had a meeting with the Assistant Deputy Minister, long title, of Health. And on page 9.2.3 of the report, you will see a series of recommendations and requests that we are asking council's endorsement to send these comments on the health provision of services review that the province is doing right now. So I just wanted to draw it. It's just not endorsing minutes, it's actually endorsing the recommendations. And these would be the Region Appeals official position. And I would move the report and those recommendations.
Great. Thank you. Councillor Parrish.
Yes, as a follow-up to this, I'd like to commend Acting Commissioner Bursey for her stepping forward, and Sue Ritchie enthusiastically looking into taking closed down school sites and refitting them with Habitat for Humanity for some seniors' dwellings and daycare. Met with her yesterday, and Sue Ritchie seems like the most dynamic person I've ever been in a room with. And Acting Commissioner Bursey was fantastic. These are the sorts of things. We brought it up with Sharon Lee Smith. She loved the idea. We're going to try to take it one step further, and instead of the schools offering it to their coterminous boards first, and then to us to pay, we're going to ask the province if this could be their contribution, because it's money already gone. They've spent it, they've built the schools, they've used taxpayers' dollars. Perhaps they could transfer the properties to us, and away we go, and put in some really good housing steps forward. So I want to thank the chair of the committee, Councillor Sato, for arranging for Sharon Lee Smith to come, and I think it's a really good committee. It's working well, and I thoroughly enjoy being on it.
Thank you very much. Seeing no further speakers, Councillor Sato has moved the recommendations and the minutes. All those in favor? That's carried. And the last is an added item, communications from the Association of Municipalities of Ontario. It's been moved by Councillor Palashi. Are there any questions on this? It's about the most recent provincial announcement. All those in favor? That's carried. Thank you, Mr. Chairman. I'll turn it back to you.
Thank you. Items related to Human Services, Councillor Miles, if you chair this section, please.
Thank you, Mr. Chairman. Item 10.1 is a report on the evaluation of Peel Region emergency food systems. The recommendation is simply that we evaluate it and come back with recommendations to council. Councillor Parrish?
Yes, I'll move the motion. I support it wholeheartedly. We have several food banks in the South End in Mississauga that are slipping away from the central food bank, that the whole system down there needs to be looked at, and our grant system. There are a lot of people that are using food banks, and they're not just using them sort of year over year. There's sometimes 3 months, 4 months, they get back on their feet. And I think the whole system has to be looked at carefully. You've got a volunteer sector delivering something that really should be up to us to be delivering. So at the very least, we should follow our grants, make sure they're being used to their absolute best. And all these little groups that are infighting, I've never seen such things in my life, where people who care about other people and volunteer tend to take shots at each other. But, geez, it sounds like politics. Anyway, I support it, I move it, I'm happy with it.
Great. Carolyn Parrish has moved the motion. Sorry, Councillor Parrish. Could I have a seconder? Councillor Sato, all in favor? That's carried. The next two items have already been dealt with in regards to affordable transportation. And we are on item 11.1, which is an item of communication here for receipt. Councillor Raz?
Thank you, Madam Chair. And I just wanted to say I had the privilege of meeting with the folks from the Citizen Apprenticeship Pilot Program that they're looking at developing. And I would encourage other councillors to look at this. I'm just fascinated by the fact that we can have a wonderful volunteer program that will get new Canadians involved in how to become in volunteerism and expand their citizenry. It's like a gym membership. If you don't use it, how can you participate? So it's a bit of a catch-22. So I had the pleasure of meeting with them this week. I do have one question. Did we ever have a councillor sitting on the Peel Poverty Reduction Committee?
Take that on, they'd be grateful.
I'm just curious.
I did sit on it.
You did sit on it. Okay, thank you.
Carolyn Parrish put me on it ages ago.
Did I?
Yeah.
You missed the meeting.
It was a gift.
It was. I
Okay.
enjoyed it.
So would you like to move the receipt of the letter?
Yes, I'd be happy to.
Okay, all in favor? That's carried. Sir, I didn't get a seconder for that. It's okay?
Mayor Thompson's in.
Oh, sorry, Mayor Thompson.
Yes. I did sit on the poverty, and I do partake when my schedule allows it, but I really think it'd be important to have a couple of councillors sit on that. There is a lot of talent sitting around that table, and I think it's very important that we have somebody there. So I would like to see if we can bring that back as a recommendation to find a body to put on there, please, because I'm not doing it any justice, and it's important.
Okay, Councillor Medeiros?
Thank you, Mayor Thompson. I'd be more than happy to volunteer as a council rep.
Oh, okay. Thank you very much. So all those in favor of Councillor Medeiros? That's carried. Back to you, Mr. Chairman.
Thank you, and congratulations to Councillor Medeiros. Good stuff. Other business that was dealt with, so there are no notices of motion, no bylaws in camera. I believe the first item, I don't think we need to move into camera on.
Would you ask a question, other business?
You can, yeah.
That was on the...
Sorry, go ahead.
I just wanted to, I had a question, and I'm not sure who was handling the program, but the toilet replacement program, is that still in effect, or is it finished, or what happened to that? No, I got a question. I had a phone call yesterday.
If I could, Mr. Chairman, you're talking about the low flush toilet
Oh, whatever.
program. Council ended that program about 3 or 4 years ago.
Oh. Is there any intention to ever reopen it, or?
No, we actually commenced it when basically the marketplace was selling all non-friendly, environmentally friendly toilets. We kicked into that program to raise community awareness, and now that's building code primarily. 90% of the toilets sold in Home Depot and that are low flush. There's no need for us to compete to get people to buy those toilets. But that's something council wants to get into, but it's just, we don't see it as value added and impacting our needs to conserve water at this point.
Okay, great, thank you.
Mayor Jeffrey.
I wondered if I could get an update about the conversation we had at the last regional meeting with regards to the homelessness issue. I know there was a meeting with council, the two council reps and staff, and I just wondered if we could have an update as to how it's going.
It's going really well. We actually, Councillor Moore and I met with both Commissioner Bursey and Commissioner Smith. We explored options, and we do have a meeting with SHIP to see whether or not there's some opportunities there. So we were on it the next day, and we're really looking forward to being able to come back with some recommendations to council.
When?
Madam Mayor, that was...
You were on it the next day. I'm real pleased. That's great.
We're on it.
So-
We have our next meeting booked, and we will bring it back to you as soon as possible.
Terrific. Thank you. Thank you for your work.
Thank you. I have no one else on the list, so there's two in-camera matters. Do we need to move into camera, or? On the first one, it's in town of Caledon, so Mayor Thompson, would you move that? And seconded by Councillor Groves. All in favor of that, then? And if someone would like to move 15.2, moved by Councillor Moore, seconded by Councillor Raz. All in favor, then? Opposed, if any? Carried. I have a motion moved by Councillor Gibson, seconded by Councillor Kovac, that bylaw 15-2016 to confirm the proceedings of Regional Council at its meeting held on February the 25th, 2016, and to authorize the execution of documents in accordance with the Region Appeal bylaws relating thereto, be given the required number of readings, taken as read, signed by the Regional Chair and the Regional Clerk, and the corporate seal be affixed thereto. All in favor? Opposed, if any? Carried. Motion by Councillor Sato and seconded by Councillor Yanika that the February 25th, 2016 Regional Council meeting be adjourned. All in favor? Carried. Thank you.